Hello and welcome. Myself, Dr. Deepraj Mitra. I shall be walking you through a very important aspect of anatomy, that is about the osteology of the upper limbs. Now, as all of you know, whatever plan you make in your life, that is supported by a solid and robust blueprint and a foundation. Likewise, in the human body also, the robust foundation is provided by the bones in the form of the bony skeleton. Now, today we can discuss about one such bone of the bony skeleton belonging to the appendages, that means the limbs, the upper limbs to be precise, and that is the clavicle. The clavicle is also named as the collar bone, and it is present at the junction of the root of the neck and the anterior chest wall. Okay. Now, clavicle serves many important functions, which is shown in the slide in front of you. For example, it helps the upper limb to swing clearly on the side of the trunk to prevent brushing of the side of the trunk with the upper limb. Next, it helps in transmission of forces from the appendicular to the axial skeleton. Thirdly, it protects the important neurovascular structures at the root of the neck. Last but not the least, it also plays a pivotal role during elevation of the arm above the head. Besides this particular bone is also unique in many ways. What makes the clavicle so much unique? Let's have a look. Firstly, the first bone in the human body to start ossification. Not only that, it is also the last bone in the human body to complete ossification. So, first bone to start ossification and last bone to complete ossification. Next, it is disposed horizontally in the body, just beneath the skin, that is subcutaneous, and also beneath the platysma of the neck, that is subplatysmal. So, subcutaneous, subplatysmal. Next, it is an example of a modified long bone. Long bone because it helps in transmission of weight, and modified due to many reasons that I am going to unravel at the end of the session. Another example of the modified long bone in the human body is the body of a typical vertebra. So, body of a typical vertebra and the clavicle constitutes two examples of the modified long bone in the human body. Now, here we see anterior view of the chest wall and the root of the neck. You can see at the junction, here is the clavicle encircled by the red line. Okay, so that's the clavicle properly disposed in the human body. Now, about the look of the bone, we are viewing in the right clavicle from the upper side and the lower side. In the top of your screen, that's the superior view. Lower part of the screen is the inferior view of the right sided clavicle. Parts of the bone, as you can easily delineate, there are two ends. That flatter end is the lateral end that will articulate with the acromial process of the scapula, forming a joint to be discussed in detail later on. Know the name of the joint: acromioclavicular. So, acromioclavicular joint, and this one is the broader end, named as the sternum of the medial end, that fits or articulates with the sternum clavicular notch. The joint is named as the sternoclavicular joint. So, at the flanks, two ends, one broader and one flatter. The flatter one is meant for the acromion process of scapula, broader one for the clavicular unit of sternum and the first costal cartilage. Sternoclavicular joint, acromioclavicular joint. Next, the intermediate portion, this is the shaft, that laterally in the lateral 1/3 is flat on cross section, and the medial 2/3, the major portion, is cylindrical on cross section. So, presenting parts, a couple of ends and an intervening shaft that presents a change of cross section. Now, if you look from the lower aspect, the shaft presents a groove, well marked groove, that is named as a subclavian groove. Why? We shall see later on. Besides, we get a tubercle over here known as conoid tubercle, and from there a line we get over here. That line is the trapezoid line. Okay, so subclavian groove, conoid tubercle, trapezoid lines are the features of the inferior surface, the notable features of the clavicle. Okay, so with this info we proceed gradually the next portion, which is the muscle attachments. The ones in red depict the origins of the muscles. The one in dark colors depict the insertion of the muscles. From the upper aspect, if you see over here, the medial side, we get two muscles origin. One is pectoralis major, other one is sternocleidomastoid, both clavicular heads of origins. On the lateral aspect, we can see deltoid, anterior 5s origin, and the trapezius over here, that is insertion. So trapezius, deltoid laterally, pectoralis major, sternocleidomastoid, clavicular heads medially. In inferior aspect, notable features, very well marked groove, subclavian groove. I told you why, because that is receiving the insertion of the subclavius muscle. On the medial aspect, another muscle takes attachment, that is the sternohyoid, and one ligament is attached over here, that is the costoclavicular ligament. So costoclavicular ligament and sternohyoid close to the medial end, subclavian groove in the middle of the shaft, and along these two structures or features rather, the tubercle and the ridge, we get to see the attachment of the conoid and trapezoid parts of the coracoclavicular ligament that affixes the clavicle with the coracoid process of the scapula. It's a very important ligament that transmits the weight basically from the upper limb to the axial skeleton. Okay, so that's in a nutshell the attachments of the clavicle. Next, what you can see in this diagram or X-ray, that's a well marked view of the fracture of the clavicle. As you can see, this clavicular fracture, and the commonest site of the fracture clavicle is supposed to be the shaft, the junction of the lateral 1/3 and the medial 2/3. So shaft of the clavicle, junction of the lateral 1/3 and medial 2/3 is very vulnerable to fractures. The reasons for the fractures we have outlined. Let's see what are the points in favor. That's the change of two curvatures. As I told you, lateral portion is a bit flatter on cross section, medial portion a bit cylindrical. So this makes the zone vulnerable. Secondly, that is a change of cross section. Okay, two curvatures and two cross sections, they change over these zones, that makes the joint zone a bit weaker. Thirdly, no muscle attachments over here. Clear? So that is bereft of muscle attachment, that makes the zone again a bit weaker. This is supposed to be the site of appearance of the two primary ossification centers. You will see later on that initially we get two centers of ossification along the shaft, and they are the primary centers that appear at this particular zone. What more, this particular zone may be pierced by a cutaneous nerve known as the supraclavicular nerve. That nerve may occasionally pierce this clavicle at that particular site. So the zone becomes weaker and prone to fractures. Hope it is clear to all of you. Now, as you can see regarding ossification, these two are the initial zones of appearance of the ossification centers, primary centers for the shaft, at about 5th to 6th week of the intrauterine life or the IU life. For the broader sternal end, we get to see a secondary center that appears at about puberty and fuses the shaft at about 21 to 31 years of age. So we say that's the last of the bones to ossify. Okay, that's to be noted. Now, the clavicle is very aptly a part of a very important entity of the upper limb, the pectoral or the shoulder girdle, which includes another bone, the scapula. So scapula plus clavicle constitutes the pectoral or the shoulder girdle, the details of which we shall discuss in subsequent sessions. Now, that's a view of the pectoral girdle or shoulder girdle. The bones are highlighted in yellow. clavicle and the scapula. Now, let us talk about the important questions about the clavicle. Let us figure this out. It's an MCQ sort of thing. What's not true about the clavicle? It's mostly membranous ossification, horizontally disposed, no medullary cavity. The last point is the most common site of fracture is the junction of medial one-third and lateral two-third of the shaft. So obviously this one is the odd one out. That's incorrect, because the junction of lateral one-third and medial two-third of the shaft is the weakest point of the bone, and that makes the fracture most common at this particular site. The upper 3 points, mostly membranous ossification, horizontal disposition, lack of medullary cavity, plus sometimes I told you pierced by a cutaneous nerve, These 4 points, this quartet makes the bone a modified long bone. I told you at the very outset that long bone, because it transmits weight via the coracoclavicular ligament and the medial two-thirds of the shaft, these two factors aid in the transmission of weight. That's why it's long bone. And these 4 points I mentioned over here, this quartet makes the bone a modified long bone. So pierced by cutaneous nerve occasionally, no medullary cavity, horizontally disposed, and mostly, note the term mostly, membranous ossification. These will make the bone a modified long bone, the clavicle. Okay, let's move on to the next question. That will come up along the screen. Now, which of the following nerve may pierce the clavicle? A very apt question. You must be wondering which nerve pierces. I told you previously, that's clearly the supraclavicular nerve, to be precise, the intermediate division. There are 3 divisions, we'll come to know later on. The intermediate division of the nerve may pierce the bone. The other 3 choices are incorrect. Okay. Now, to brush up the important points, number 1, that is the first of the bones to ossify and last of the bones to complete ossification, that we discussed in detail. It's an example of a modified long bone. I told you why modified and why long bone. Next, it's mostly membranous ossification. We discussed this. Sometimes pierced by a cutaneous nerve, supraclavicular. Okay, and initially it presents with 2 centers of ossification for the shaft primary centers that fuse later on to form a single center. This is all we discussed, just to brush up your memory. What more? Due to fall on an outstretched hand, it is the commonest bone to undergo fracture by indirect violence, because the force immediately traverses up the upper limb to reach the clavicle, which fractures at the particular site. So, commonest bone to be fractured by indirect violence due to fall on outstretched hand. What else? As I told you umpteen times, the most common site of fracture of this bone is the junction of the lateral one-third and medial two-thirds of the shaft. So, that's all about the clavicle. Hope you enjoyed the session. Thank you. Thanks a lot.